Hi guys, my name is Michaela Dar. I'm going to be discussing my health literacy issue, which is misuse of medications. So first off, I want to start by defining what misuse of medications is. Misuse of medications is using a medication that's not prescribed to you, using too much of a medication, using too little of a medication, not taking it appropriately. The ways that I want to try to, that I'm going to propose implementing in my job is, first off, patient communication. I want to enforce that when receptionists are taking patient calls to make appointments, that we enforce that any new medications that they are taking may be prescribed by a specialist, or they went to urgent care for whatever reason and they were giving an antibiotic or given something for short-term, long-term use, that they bring it in on their next visit. Medication lists can be a variety of things. Commonly we think long-term medications, but no, it needs to be everything. We need antibiotics, we need herbal supplements, diet pills, any home remedies that the patient's taking, herbal supplements, anything and everything, birth controls, muscle relaxers, anything. Also the long-term medications, like I said, hypertension medications, diabetes, anything that they could be seeing from a specialist that maybe we didn't prescribe but somebody else did. So that's my first thing, enforcing the receptionist to take a little bit more screening of the call and make sure that patients are aware before coming to the visit to bring medications. The next thing I want to implement in my office is nurses, when they are taking patients back, to get a full list of medications and allergies. Now the thing with allergies is that patients can be allergic to an active ingredient in an allergy. So it's very important to get all allergies and medications. With doing that, we're going to avoid patients having reactions to these medications. So that's another thing, making sure to get any medications that the patient has. The next thing I want to implement in my office is handouts. When a patient gets a new medication, I feel it is important for the patient to have something visual to look at when they are there to go over with the provider and when they go home. I know myself, I'm a visual learner. I learn by seeing it over and over again. And if I have questions, I like to sit down and say, hey, what does this mean? And be able to have that ability. Now, we assume that pharmacies go over these medications with patients. But personally, how many times have you gone into a pharmacy, been prescribed an antibiotic or a medication that you're going to be using long term, and said, no, I don't need to talk to the pharmacist, I got it. And then went home that same night and said, what is this medication even for? So with enforcing handouts, which I have a site that I found, which is the FDA, which is the Food, Drug, and Administration, common site that we all know in the field, that if you look up, I have on the board, FDA Medication Guide. Under this guide is all medications that we would possibly prescribe. You're thinking, okay, patients can do that at their house. Yes, patients can, and giving them that site will help them do that at home too. For if any reason they go to another doctor and they need to look up the medication as well. Yes, but they don't. So with us giving them all the knowledge they need on these medications, we're avoiding the misuse of medications. I'd really like for the owner who is a provider to discuss this with the other providers, saying, take the extra couple minutes. It'll help us in the long run. It shows that we're more knowledgeable and we know what we're talking about. We know what we're prescribing. So so this is how I would do it. The prescriber sees a patient, prescribes a medication, lets the nurse know what he prescribed, then tells the nurse to search it on the site. The nurse gives him a handout. The provider now will go over that medication with the patient. What the medication is, what it's used for, what side effects to look out for, and what side effects that are usually common with this medication. Doing that will take a lot of will ease the patients a lot. It's something that, not a lot of people think to do. It seems so common, but we don't do it. So with doing that, I feel like we'll be able to eliminate the misuse of medications. With providers going over the medications, patients can leave understanding, okay, this medication's for this, and taking the handouts home. I know so many times where I'm like, I need to look up this medication. I have no idea what I'm taking it for. And I work in the field, so I can only imagine how it is for patients. So my health literacy issue and misuse of medications to avoid this in my office is handouts, enforcing that doctors take that extra time, not to be so time sensitive. I know we're all busy. It's a busy field. We're all seeing a lot of patients. We're all working a lot with the patients. But taking that extra time just to tell them about a medication, it really doesn't take that much time. And it gives a lot of ease off. It takes a lot of stress off the patient. So this is my health literacy issue. Thank you.